Hi folks, this is John Adamson, the Rehab and Documentation Guru. So today I was looking at a memo that's on one of the Facebook pages for rehab staff. And in that memo, I don't know what level that memo came from, whether it was director of rehab or above that level, but it was to the staff. And one of the items on that memo, post PDPM, was that any staff that took off time that was not pre-approved had basically, if they didn't come in and see their patients for their needed time, then they've committed patient abandonment. Now, I don't think that this operator meant abandonment. I think they might have meant neglect, but let me tell you what abandonment is legally. Patient abandonment means that you've separated yourself from the care of a patient without providing them the opportunity to have another care provider take over. And so if you don't get to a patient on a given day, but you're coming back to see them, you have not committed abandonment. So that one thing makes that statement wrong. But then let's talk about neglect, which is what I think this DOR or above was indicating. What is neglect? Patient neglect. Well, patient neglect is withholding treatment from a patient that needs it, that then causes harm to the patient because you didn't do what the patient needed. So that is patient neglect. And let me just tell you something about most therapy interventions. I'm saying most. Most of the time, if we don't do a certain intervention as a therapist for a patient, even though they should have it, we're not going to cause them harm. So as a therapist, it is really hard to establish, I should say, a legal suit against a therapist. It would be really hard to establish that we've truly committed medical neglect. Obviously, like nursing, if they don't give a patient, let's say, a medication that stabilizes a patient's heart rate and they've got AFib, and because of that lack of medication, the patient ends up getting AFib and throws a clot and has a CVA. Well, that is truly neglectful in that case. If they had the ability to provide it and they didn't do it, and it can be proven that it was their responsibility to do it in the first place, that could be medical negligence. But as far as therapy is concerned, it would be much harder to establish medical negligence where you've withheld something and it caused harm, actual harm to the patient. So anyway, this memo, if you've seen it, you know what I'm talking about. But I want to clarify that please do not take, when you get memos and people bring up these legal issues like medical negligence or abandonment or something like that, make sure you look up what these terms actually mean, because these terms should not be just bandied about. They are very serious, for one thing. I mean, you can lose your license for stuff like that. So for some director of rehab or above, just willy-nilly saying, if you do this, you're committing neglect or abandonment, look up what the actual legality of that statement is, because they shouldn't be spouting off at the mouth when they don't know what they're talking about. Those charges have serious ramifications. Anyway, this is John Adamson, the Rehab and Documentation Guru. On that happy note, have a great and pleasant day. God bless.